Okay, so now we're going to talk about treatment. Treatment of we'll start with diabetes type 1. Right. So, what's the problem with diabetes type 1? Don't have enough insulin. That's the problem. What do you do for them? Give them insulin, right? That's simple, sort of. Not quite that simple. The problem is, the reason it's not that simple is because if you think about it, we don't always have a bunch of insulin out there, right? We respond to what's eaten, right? We respond to what our blood sugar level is, depending on to release insulin or not release insulin, right? Um, so now our insulin, we're not releasing insulin. We're going to try to replace that. We can't just give them a bunch of insulin, right? We have to try to dose it. Now, when you think about it, or I'm going to tell you that our insulin, we have a basal layer, right? And they call that basal layer. That's a certain amount of insulin that we always have, right? It doesn't really drop below that, or it's not supposed to. Kind of keep this level of insulin. It's a low, kind of even level. We eat something and it spikes up, right? This guy here tastes it, says boom, spikes up. So we eat something, it spikes up, and then it comes back down to this basal level, kind of goes across there, and then eat something, and it spikes back up again, right? And so that's what we try to mimic. In order to do that, we have to try. A person who's diabetic has to be able to plan their meals out. It's not just eating when you feel like it or skipping a meal when they feel like it. You really have to plan your meals out, and you really have to stick to the times that you eat, because we're going to give you insulin just for those times, just for the amount of food that you normally eat and the amount of activity. So when those things change, the times that you eat, the amount that you eat, or the activities that you're doing, when those things change, it's going to throw off your blood sugars, because we can only give an average to take care of what you usually do. If you look in your book on page 1126, page 1126, table, no, not table, figure 48, figure 48-4, is it? Yeah, -4. That table there shows the different insulins that I'm about to talk to. I don't think our numbers here are exactly the same, but I think mine here to make it a little bit easier for you to remember. So I'm going to go ahead and use what I got here. You got to understand the timing on these insulins. So you got to understand what these things are, what these insulins do. So in order to do that, you got to know what their time of onset is, right? How fast will it start working? Want to know what their peak is. When will it actually be doing the most that it can do, right? When is it really going to peak? And then you want to know what the duration is. How long will this insulin that I give them continue working? Got to know these things. All right, that was like, oh, after I screwed it all up. So, so if I go here, you start out with, first of all, I'm going to talk about rapid. Rapid acting insulin. Its onset, it starts working in about 15 minutes. Your book probably gives you a range, like, I don't know, 10 to 20 or something. 15 minutes onset, about how long it takes for it to start working. Also, you've got a couple of different names that are rapid acting there in your book, so you need to look at your book too. It peaks in 1/2 to 3 hours, right? So, and I'm telling you, these usually are closer to that half. Starts in 15 minutes, half an hour, 45 minutes, that sucker's peaked usually. And then its duration is 4 hours. So that's how long this rapid acting stuff lasts. It's not a real long time, right? There's 24 hours in a day. That's about how long it'll last. Now, that's the rapid acting. The next one we're going to talk about is what we call short acting. Short acting, and it will start working in about a half an hour. Instead of 15 minutes, it takes a half an hour for it to start working. So if you're going to give them this before their meal, you're going to give it to them about a half an hour before they eat. You give them this, you want to give it to them about 15 minutes before they eat. Its peak is 2 to 5 hours. Its duration, about 6 hours. Next one we're going to talk about is intermediate. Damn long word. Okay, intermediate. Onset, 1.5. So 1.5 hours to 4 hours. That's how long it takes for it to start working. Right? That's the window there. You can expect that it's going to start working. Intermediate takes a little while to get going. And it's going to peak at about between 4 and 12 hours. That's when it peaks. And it lasts for 12 to 18 hours. Right? So we're hoping around 12 is usually about where we want it to last for. Then we got our long acting. And this one here, its onset is 1 to 4 hours. It might actually start working a little bit faster than the intermediate. And its peak is something that we don't talk about because it doesn't really have a peak, and I'll show you why here in just a little bit. Its duration is 20 to 24 hours, and we are shooting for that 24. That's what we want it to last. Really easy to dose that. Now, to kind of explain these things to you so you get an idea how they work. This here, that's time. This guy here, this is your action. So if you come along here, and you got your hours ticked out here, and this is time down here. This here is your action. So you give them rapid insulin. It starts working in about 15 minutes. That's about a quarter of the way to that hour, right? This is 1, 2, 3. So it starts ticking right in here. Starts working, and it gets to a peak really fast, right? Boom. And then it's going to come down really fast, right? And that's how this rapid acting works. And the short acting is just a little bit behind it, over like this, or be over there like that. Next one I want to talk about then is your intermediate acting. Now it takes that guy an hour and a half to kick in, so it's over here. So you gave it at the same time. It's going to start working about right in here, and it's going to peak 1.5 to 4 hours. So there's 1.5 to 4 hours. And then it's going to last about 18 hours. So boom, way off the chart over there, right? So now if you're going to give, now we're going to give the long acting. So it's going to kick in here about an hour. It's going to come on up. Doesn't really peak. It just kind of goes like this. Yeah, very, very, very slowly drops until after about 24 hours, it's down there to where it's not doing anything anymore. All right. And now, the beauty of this 24-hour insulin is that because it does this, it provides a basal layer. I was talking about how in nature, in a healthy person, we get up and we kind of have a basal layer of insulin. Well, in this case here, that's what we're providing. And if it lasts 24 hours, it's wonderful because you can give it to them at 7 o'clock every morning, and they have this basal layer that lasts them through the day. And all you have to do is give them a peak every time they eat, right? And so you give them that, and then when they're going to eat, you go ahead and you give them this, and you give them this short, rapid or short acting, right? And that'll depend on the person, how much they eat, what their activity is, stuff like that, how fast they can eat. Do they have the tray right there, and they can take it right? They usually can take their shot, and then they want to eat right away, or do they take their shot, want to read the paper, and then eat? And just you'll have, there's other things to work out here depending on which one. But I'd say most of the time it's the rapid that I see people using now. That didn't exist 10, 15 years ago. I don't know exactly how long. It hasn't been out forever. Not as long as I've been a nurse, it hasn't been around. So anyway, you got this rapid acting insulin, and you got somebody at 8 o'clock in the morning is going to eat. 7:45, give them a shot of rapid acting insulin, right? You can give them both, right? So that you get them both at the same time. The rapid acting will kick in. You give them both here. 7:45 will say this is the rapid acting kicks in here. The long acting kicks in here. Boom. At that point, you got them. You got this action here. That's going to continue working. And then when that guy eats again at at noon or 1 o'clock or whatever, you're going to give them another dose of rapid acting. You're going to get it like that, and you're going to have these. So then, so every time they eat, you're going to give them this. And how much they get here is going to be determined by what their blood sugar is. This will be ordered as a sliding scale insulin, right? This is a dose that they give that they figure out by their numbers how much to give, and then this one here is going to be they're going to give them a sliding scale. And what a sliding scale is you will check their blood sugar. You'll check their blood sugar, and then you look on the chart. You've got an order there, and they're usually like, I know at Mercy they have a low dose one and a high dose one. It depends on the person which one the doctor will use. But there's actually a formula for figuring out exactly how your sliding scale should be. But I don't expect you to know that. But what I do expect you to know is what a sliding scale is. And a sliding scale is you'll stick their finger. If their blood sugar is between here and here, you don't give them any. No rapid. If before they eat. If their blood sugar is between here and here, you're going to give them 4 units. Between here and here, you're going to give them 6 units, right? So you're going to look right on there, and you'll know exactly how much rapid acting insulin you're going to give them, and that will control what's coming in, right? Because they're not making anything here, so then you're controlling it. You got your basal handled there. Another thing is sometimes these long actings just won't work. They don't last like they're supposed to. So then a lot of times what they might do is they might give them one of these intermediates. If you got a person and this doesn't last very long, let's say it's only lasting the 20 or maybe even less, they're saying, well, when we don't have them covered very well, they might just let it go with that. Let their sugar get high, and they'll cover it when they start here. Or they might decide to give them an intermediate in the evening. So anybody who gets an intermediate in the evening should take a snack before they go to bed, because you don't want them to get real low while they're sleeping. So, and another thing you can do with the intermediates, if they seem to last about 12 hours, you can kind of use them as a basal, right? So then they're not taking this here because it doesn't seem to work, and the intermediates don't last as long either, but then you can use them. They get it here, and it kind of comes up and goes back down, and then you give them another dose here where it will come up like this and go back down. So you give it twice a day because they last 12 hours, and you can end up kind of getting similar to a basal level. It's not as pretty as that long acting is, but you still get that spread out over the time period, and you can still treat these. And as long as you're doing them with a sliding scale, you shouldn't cause a hypoglycemic episode. So that's how the insulins work. Now we'll be talking about how some of the medicines work. I think that's what we're up to.